Hi, my name is Dexter Hoffman, and for my individual research proposal, I was interested in how perceived early childhood experiences can improve resilience in adulthood. So, what do we already know about these variables? We know that negative childhood experiences have consequences. They can lead to mental illness diagnoses such as depression, anxiety, substance use disorders, and post-traumatic stress, as well as higher levels of suicidal ideation. We also know that resilience is a protective factor and that resilience can be taught and practiced and grown. It is not something that people are naturally born with. So, why would this study be important? There is little research that exists on the potential positive outcomes of negative childhood experiences. A study done by Santarelli and colleagues in 2017 showed potential positive outcomes in mice when they were given adverse experiences when they were younger. But there's little research involving human subjects. We also Results could also be beneficial for both clinical and research settings. All of that being said, my hypothesis is that there will be a positive relationship between adverse childhood experiences and higher levels of resilience in adulthood. Participants will be collected from a college student population. We are aiming to collect about 200 participants. They will be recruited via SONA and offered incentives, whether that be like research credits or a gift card. And given that we are collecting this data from a college student population, the expected demographics would be a majority female with white ethnicity and the mean age ranging anywhere from 19 to 20. The measures that we'll be using are the Adverse Childhood Experiences Questionnaire and the Brief Resilience Scale. The ACE-Q measures forms of child maltreatment and dysfunction in one's early environment, including neglect and various forms of abuse. It's composed of 10 close-ended questions, yes or no answers. And the Brief Resilience Scale measures basic properties of resilience. Uh, Basically, it's just kind of looking at how one's ability to bounce back from stressful situations. And it is composed of 6 statements that are on a Likert type scale. Participants will read the statement and rate either 1 to 5 with how much they agree. Here's some examples from each measure. On the left are just a couple questions from the ACE-Q. And then on the right, these are all of the statements on the BRS and how they are scored. So the procedure, it will start off with an informed consent statement, just kind of explaining to the participant what we're looking for, what our variables of interest are, and the risks and the benefits to participating. And it will also let participants know that if at any point these questions are bringing up negative feelings, they are welcome to decline answering at any point. Once they read that, they will be asked to sign and enter their contact information. The main reason that they'll be asked to enter their contact information is because we would like to follow up with them in a year and ask them to take these surveys again. But at that year point, they will be notified that they're welcome to decline. Once they're finished with that, then it'll lead them to the ACE-Q. That will be the measure that is taken first. A quick summary will appear before they answer the questions, just kind of explaining what the scale is and how to answer each question. Once they're finished with that, then they will be taken to a page with the BRS, which will do the same thing. Quick summary of what the measure is, how to answer the questions, and then it will have all of the questions. Once they are finished with both of these, then they are finished with the study and welcome to exit the page. When scoring both of these measures, scoring the ACE-Q, it is out of 10. So each yes answer is 1 tally and no is no tally. So the sum of the yes answers determines the individual's ACE score. Higher ACE scores, more adverse experiences, lower ACE scores, less. And the BRS scoring is adding the values of each individual answer together and taking that sum and dividing it by the number of questions, which would be 6. And this normally gives you a score that ranges from 1 to 5. We will report the mean and the standard deviation of the scores for each measure. But when it comes to statistical tests for data analysis, we will use the Pearson's R correlation to really examine if there is a relationship between these two variables. This data could be beneficial to many different people involved in the psychology field. If it does show that higher ad levels of adverse experiences can lead to higher levels of resilience in adulthood, clinicians can take a different approach with their trauma clients, and kind of encourage and grow resilience in these clients. Researchers can also expand on this data by adding different variables, such as maybe a protective factor scale, or collecting more data. If you have any questions about anything that I've said, please comment them below and I'm happy to answer. But if you're uncomfortable with commenting your questions and would like to have a discussion, you can always email me at dexterhoffman@isu.edu and I will get back to you as soon as possible.